So you're out with some friends and you rolled your ankle, you're having some pain and you're not sure if it's sprained or broken. That's what we're going to be talking a little bit about on this week's episode. And before we get into the video, as always, please remember to like, comment, and subscribe below. So what is an ankle sprain? An ankle sprain, or a sprain of any joint for that matter, really refers to damage to the ligamentous structures that are surrounding the joint. A lot of you guys might be thinking, what are ligaments? And what does damage to the ligaments look like? The ligaments are essentially areas of connective tissue, little bands or cords of connective tissue that connect bone to bone. And sometimes in your ankle, where you have lots of small, tiny ligaments, when you roll your ankle or you trip and you fall, these ligaments can get sprained by getting stretched, or sometimes they can also get torn. And the degree of the injury that occurs with regards to these ligaments is how we define different types of ankle sprains. So with regards to ankle sprains, how do you know if your ankle is sprained or broken? So when it comes to ankle injuries, a lot of the times it's hard to know whether it's broken or sprained without getting someone to do an in-person assessment. Most commonly, ankle injuries are either inversion or eversion injuries, and by far, we're seeing a lot more inversion injuries because, again, the outside bone of your ankle, known as your fibula, is just anatomically longer than the bone called the tibia, and so your ankles are just more prone to rolling inward whenever you roll them. Those are by far the most common injuries that we see, and when you roll your ankle inward, patients will actually have pain on the outside of the ankle because those are the ligaments that are going to get stretched. Now, when a healthcare provider assesses an ankle injury, we look for various things. We look for pain on the inside, the inner or medial side of the ankle. We look for pain on the outer side of the ankle, and depending on where and what region of the ankle there is tenderness, we can make a calculated decision in terms of determining whether or not you need an X-ray to see whether or not you have a fracture. Needless to say, this is a very nuanced process, and if you're worried after rolling your ankle that you might have suffered an ankle sprain or a fracture, I always recommend you get seen for an in-person assessment to determine where your area of pain is and to make sure that we're not missing something that can lead to problems down the line. You could be looking at issues related to arthritis and ankle instability if the ankle fracture isn't treated appropriately, and that can ultimately lead to other things down the line like chronic pain. And given that a lot of the times we're seeing ankle injuries in young, healthy patients, it's quite possible that if an injury goes undiagnosed in 10, 15, 20 years, it could cause a lot of problems for our young, athletic, and active patients. Okay, so that wraps it up for this week's episode. I hope that this was valuable information for you. As always, if you're worried that you've rolled your ankle and it could be broken, the safest thing to do is to get an in-person assessment, because a lot of the times this becomes a very challenging topic to diagnose on your own at home. I always recommend going in to be seen. If you don't want to go to the emergency department, even a walk-in clinic or family doctor for an assessment is a very reasonable first step. Obviously, if you're having severe pain and you're not able to walk comfortably, an urgent care or emergency department probably is the best place to go to be seen. I look forward to seeing you next time on DxTx. As always, please remember that this is only for educational purposes. And as always, please remember to like, comment, and subscribe below. Until next time, take care.